Perfect.
Good morning and welcome to the, oh, those mics are very loud. These are gubernatorial mics. I'm State Senator Jamal Bailey. Welcome to the 36th Senatorial District. We are in the heart of the district, and I'm eternally grateful to our governor, Kathy Hochul, who is no stranger to the Bronx, and she's shown time and time again that she is willing to come to the Bronx to make sure that she sees the investment that the state is making. And the investment that we have is in our people, making sure that we are all vaccinated and that we are reminding everyone that you should continue to get vaccinated if you haven't already been. But again, we're kicking off booster shots, making sure that those who are immunocompromised, those individuals who have those immunocompromised, comorbidities, as it were, that if you're eligible, you should get that booster shot as soon as you can. These vaccines save lives, and those individuals who have been saving lives for us are our first responders and healthcare heroes. We used to bang pots for them at 7 p.m., but we should continue to give them a round of applause because without them, we would not be throughout this pandemic. So I'm grateful to the team at Somos for this site because, it is in the heart of the district. And my district, this zip code that I reside in myself, 10466, is significantly under-vaccinated. So to my friends and my constituents, my employers in this area, in this zip code, I implore you, I ask you once again, please continue to get vaccinated. It can and it will save a life. And if not yours, it'll save the lives of people that you love. In order to make sure that we are in a place next year where we can gather in here, this senior center, without masks, it's going to take all of us in a concerted effort to make sure that we get vaccinated. Again, I want to thank the governor, Borough President Diaz, who has been no stranger we're on his farewell tour. But he is going to be ever present and omnipresent as he's been. He is someone who, from the beginning of this pandemic, who has touted the need for vaccines, who has made sure that individuals that need this through his office, through the constituent services, and also some work of his own, right, Mr. Borough President? Personal time, making sure people get vaccinated. So without further ado, I'd like to introduce our great, sadly outgoing, but we got a great new incoming one, Borough President Ruben Diaz Jr.
Good morning. Thank you, Mr. Chairman, Senator Jamal Bailey, to the next and incoming Borough President, Vanessa Gibson, to Madam Governor, Kathy Hochul. As Jamal said, you are no stranger to our borough. I just want to say that, let me just remind everybody how COVID really decimated and devastated us here in the Bronx, as it did not only throughout the city and state, but throughout this country and the world. We saw a lot of death here. We saw a lot of sickness. We were also given a psychological blow because we made so many gains in our economy. We were just celebrating the most robust Bronx economy the February before COVID hit us. And what we were able to accomplish collectively over the last decade or so was erased in 11 months. And when we heard a lot of attention being given to other parts of the city and the state, we were so thankful when Henry Munoz and Dr. Tayat and the good men and women from Somos were able to come to our borough and coordinate with the state, make sure that we had testing, and make sure that that testing was readily available in every corner of the borough. And that instilled hope in us. And I know that now they are touting the Avengers in their comic books, but we implore to the good people at Marvel to put a doctor and a nurse and so many of our essential workers that you see behind us to be on the Avengers. They are our real heroes and heroines, and for that we thank you and we thank them. To the governor who's here today, who has been an amazing friend to the borough in good times, but you really judge your friends where they are and when they stand with you when you really need them the most. And Governor Hochul has been able to continue to provide that leadership to all of our Bronxites who have already given of themselves and have shown an example We're proud of the efforts that we've made with vaccination, because vaccines, ladies and gentlemen, are the answer. Vaccines are is going to avoid and has avoided so many deaths. The vaccines have avoided the sickness and the oversaturation and the overcrowding in our hospitals, and has allowed for our doctors to pay attention to other medical needs that we need people in our borough to have. The vaccines is what's getting our economy back. But today, standing with the governor, the fact that she's here is saying that if you've been vaccinated, if you have pre-existing conditions, if you are an abuelito or an abuelita, a granddad or a grandma, somebody who's up there in age, it's time to get the booster. And so the good folks here at Somos, the good folks here at Bay Eden have already been providing that, and I'm so happy that once again, the Bronx, particularly communities of color, Black and Latinos, who have suffered the most, who need to understand that you need to get vaccinated, but you need that booster, has once again found a friend, an ally, a support, a champion for us here in the Boogie Down Bronx. Ladies and gentlemen, please help me welcome to the mic our Governor, Kathy Hochul.
Even when you're out of office, Mr. Borough President, I want you to introduce me everywhere I go. Can we get that? Can we get that commitment? So, and your friendship runs deep. We've been friends and allies for nearly 7 straight years, and you've been unwavering in your love of this community and how hard you have fought for the people of the Bronx. And they were blessed to have you, fortunate to have you. I know they know that. But I've always cherished our friendship and your guidance to make sure that we focus on the issues that were the most important. And you're absolutely right. We did a lot of great economic development announcements, affordable housing, hotels, new restaurants. I have walked these streets so many times. I've gotten to know the restaurant owners. But I was back here again just a few months ago talking to the people in the pharmacies who are working tirelessly to make sure we had vaccines out. I went to see the Yankee Stadium site to literally talk to people and say, yes, we finally have the weapon to fight back and win this war. So, Borough President Ruben Diaz Jr., I want to thank you for your incredible leadership through, as you said, the good times and the bad, and now the great times that are coming back again. Borough President. My friend and partner in state government, Senator Jamal Bailey, who just hit the ground running when he was first elected. We've spent a lot of time supporting your local businesses, having coffee and et cetera, more than that sometimes. And I just so appreciate how you make sure that people like myself and others in Albany know that this community has been hit hard. It has an amazing future, and if you hear me talk around the state, I say I feel a lot of, I'm very simpatico with the people of the Bronx because I'm from Buffalo. And most of my life, we had a little chip on your shoulder because people don't give you the respect you think you deserve. And maybe we had some, they know now. Places like that that never were given their due, that the respect they deserve finally have earned it, and leaders like you are helping pave the way for that. I am so excited also about our incoming borough president, a dear friend of mine who I work with in a role as a council member Vanessa Gibson, and I was so excited on your election night. We've had a couple of good celebrations since then, but thank you, and we'll do a lot of great things together as well. And to my friends from Somos, and I'll be using Henry Munoz in a moment, but Dr. Chin and Luisa Perez, all the other people who've been working here at Bay Eden, you truly are extraordinary. And I'm sure you thought this would never go on this long, that we'd finally get through the worst of it. We got through the testing. Our numbers were looking better, even at the beginning of this past summer. And all of a sudden, this Delta variant just came and just snuck up on us. I mean, it was so hard because people were they worked hard, but they're getting tired. I mean, everybody's a human being at the end of the day, and they get tired and they're exhausted. And you know what? They still continue to show up. This site continued to vaccinate people. Nearly 80,000 people vaccinated right here. Let's give that a round of applause. That is amazing. I just had a chance to meet some of these healthcare workers, and they've got such a positive attitude. They know they're doing the most important work of their careers, their lifetime, and I've told many of them. I've met thousands of the workers. say this is going to define your legacy, your personal legacy. And many of them are younger, and I say when you're telling the stories to your children and your grandchildren, you will be able to say, I was there on the front lines fighting back a global pandemic, and because of what I did, there are more people who lived and were able to see their own children and grandchildren. So to all the healthcare workers, I'm going to give you an extra round of applause for everything you've done. And it was very, very good news to know that the CDC, the FDA did approve the booster shot, something we know how to get into people's arms. We're very good at that here in the state of New York. Our own New York State Clinical Advisory Task Force endorsed this on Friday by saying we support this, and therefore booster shots are now available in the state of New York. And as you heard, you have to be Pfizer. I have to wait a little bit. I was J&J, but Pfizer people, recipients, that is what has been approved. 65 and older people who've been on the front line also. If you're an exposed worker, those people who work in grocery stores, those people who've been out there driving our buses and our subway trains, the people who just never had a chance to work from home. We want to make sure you're protected. And you were some of the early individuals able to be vaccinated, so you probably, no doubt in my mind, hit that 6-month mark right now. But if you have any questions, you want to make sure you know where to contact us. But let's get people vaccinated, because I don't know about you, but I'm sick and tired of talking about COVID. I want to talk about the rebirth of communities like the Bronx and how we can help our other boroughs. We have a lot of work to do. We have a lot of challenges in front of us, and we've been fighting this so long and hard, it almost seems like it's never going to end. But my friends, there is an end in sight. And we've been given the approval to have this booster shot, which will save even more lives. And I do hope that we soon get the approvals from the federal government for children in schools to be able to get vaccinated, just like they do to be able to head off to kindergarten. They have to be vaccinated. We'll add one more vaccine to make sure that they won't succumb to this as well. So we want to make sure that you know booster shots are going to be available, free booster shots, at your pharmacies, your doctor's offices, clinics, and locations all over the site. So all you have to do is text your zip code to get this down, everybody, 438-829. Text that, and we'll show you one of the locations right near you. But also just consult with your healthcare providers as well. This is our best defense right now. And I'm really hoping that people heed the call. If you've not had your first round of vaccines, and as you mentioned, this is not one of the highest vaccination areas in our state. I think we're at about 46% in this zip code. So there's a lot of people in this very community where we're standing today who've not even had their first doses. Let's change that dynamic. Let people know enough time has lapsed. If you were hesitant in the early months, enough time has lapsed. It has been amazingly successful in saving lives. It works, and we want everyone to know we value their lives. We want them to be healthy and not end up in a hospital or worse. So please, please, please get your vaccination. I also just want to address something else. Today is a significant deadline. It reflects my priority to just stop this virus dead in its tracks. We are over it. We are done. We want to move on. And the only way we can do that is to ensure that everyone is vaccinated, but particularly individuals who are taking care of the people who are sick. And I'm talking about the confidence that people need to have. Whether you're an expectant mom heading into the hospital, checking in, an anxious time in your life, you need to be assured that the person taking care of you is not going to give COVID to you or your newborn. Can't we just say that that is a basic right that everyone has, to know that they'll be safe when they enter a healthcare facility, or you have your elderly parents or grandparents in a nursing home, that they will not get sick because of someone who's charged with their care? We're talking about just common sense here, my friends. And think about another person who's in a car accident, and maybe they're getting chemo treatments on the side, and they're just immunocompromised. They have a right to be treated by someone who will not make them get sicker. So please help us get the message. My job number one in this state is to keep people safe. Clear, simple. There's no way to cloud that. There's no gray area. I need to keep people in this state safe. And we'll be nation leading with our mandate, which strikes at midnight tonight, when everyone is expected in a hospital in the state of New York or a healthcare facility to have been vaccinated. I believe that California is going to follow suit in a couple of weeks, and the president's guidance goes into effect in late October. But we are hit the first, we are hit the hardest, and I want to be the first to say we're over this. And so I'm calling on all the healthcare workers. First of all, those of you who've been vaccinated, I thank you from the bottom of my heart for doing what was right and helping lead the way so we do have the confidence we need. And to those who've not yet made that decision, please do the right thing. We have a lot of facilities, a lot of your employers are anxious to just give you the jab in the arm and say, you're part of the family, we need your help, continue on. And many of you have spent your lives dedicated to learning about science and medicine and how we can save people's lives no matter what the illness is. We know this has been tough, we know this has been a hard decision, but we really do hope that you'll come around to that decision to help us make sure that we can do everything we can in our power. And that's what I'm using as the full power of the state of New York to ensure that we do everything to protect people. And again, this is simple common sense. We all know what common sense means. It's just doing the right thing because it's so obvious. And that's what I want people to conclude. Right now, our numbers, I will give a report as soon as we get more numbers on where we're at in terms of vaccinating our nursing home workers and our healthcare workers. I was on the phone as I was walking in here with the leaders of our downstate healthcare organizations. I told them how proud I am that many of them have achieved 98%, 99%, which is extraordinary. And I wanted them to convey on my behalf and the people of New York, thank them for their leadership in having this occur, but also to the people who listen to them. But we'll be convening what I'm going to call an operations center, where we're going to find out the resources we have at hand. I've asked some of the hospitals who have those high numbers to give us the names of individuals who are willing to go elsewhere. We're going to have to build a team and be able to respond to areas where they've not been so responsive in terms of making sure their employees have not answered our call, our requirement that they be vaccinated. So we're going to work it out. You saw the release I put out over the weekend, which was to identify all the tools that we have at our disposal. I will be signing an executive order to give me the emergency powers necessary to address these shortages where they occur. That's going to allow me to deploy the National Guard, who are medically trained, deploy people who've been retired, who may have had a license lapse, bring in people from elsewhere. That is not my first position, though, my friends. My desire is to have the people who've been out there continue to work in their jobs, work in them safely, and to all the other healthcare workers who are vaccinated, they also deserve to know that the people they're working with will not get them sick. We now know that there are cases where people are reinfected, that there are cases of breakthroughs. If that wasn't the reality, this could be a different conversation, but even people who've been vaccinated, it's a low percentage, but who wants to take that risk? Nobody. We've been through too much together. We don't want to take risks. We just want to do what's right. So with that, I want to introduce Henry Munoz and thank him and as a leader and Dr. Chin for what they've done, bringing the services here and all across the state. I've been in more of your facilities than probably anybody, and I am touched with the compassion with which you bring to your responsibilities, even outside the pandemic. Somos has been amazing, and I want to thank them, and let's hear from Henry Munoz while he's there.
Nuestro gobernador, muchísimas gracias por su servicio público y también por su trabajo en este momento tan importante por la comunidad. I'm really only standing up here because of the hard work of the people of Somos, hundreds of medical volunteers who never really get to stand in front of a camera, people like Ivelisse Esteves, who runs this site, and who from the very beginning of this pandemic have been in parking lots and community centers and public housing complexes and churches and stadiums and places like this, for no other reason than because they understand the importance of this moment to our families. Those of us who have lost members of our family, whose names we have trouble remembering today in many cases, we want to say to you that we're here because of you. And we were talking, Dr. Chen and Dr. Molina and I were talking about, Dr. Perez and I were talking about how wonderful it is to have a governor who's also a mother. You know, when I was growing up, when things got tough, if there was a problem, if my family was in crisis, we turned to our mom because there was an understanding, a compassion about how to get our family through. And that feeling of your term of office, the fact that you're here at this moment, is really important to us because you've always been a person who stood for families, who understood the importance of child health care and family leave. Somebody who understood that you really can't have a healthy family or a healthy neighborhood, a healthy community, if there's not jobs. And the only way to get back to work is for us to work together to make sure that people are tested and vaccinated and that they get the booster. We're very proud that at Somos we have tested more than 1 million people. Last week we met our initial goal of vaccinating more than 1.5 million New Yorkers. It makes us sad that in this last year we have fed more than 2 million meals to people who needed food. That means we're not healthy. So I want to say to you today, we want to say to you today, listen to your mother. Vacunate. Get the vaccine, get tested. Let's take care of each other so that all of us can go back to being a family and build a healthier New York. Thank you.
If you would excuse me for a second, because I know that Telemundo and Univision are here. Brevemente, le queremos dar estamos aquí hoy a anunciar que es sumamente importante que la comunidad latina no solamente se vacune y vengan a vacunarse aquí como lo tenemos en este centro, pero especialmente aquellas personas que son de mayor de edad. Estamos aquí con nuestra campeona, nuestra gobernadora, Kathy Hochul, para decirle que ahora el gobierno federal ha aprobado la tercera vacuna. El COVID durante el último año y medio nos ha enseñado que somos débiles como comunidad, como sociedad. Hemos visto mucha muerte, mucha enfermedad, ha afectado a nuestra economía negativamente, pero tenemos la solución y tenemos el calvario con Henry Muñoz y los doctores de Somos, y tenemos una persona que sí se procura de nuestra comunidad. Y por eso es que estamos aquí hoy. Esto es la única forma, la única defensa para poder progresar como comunidad. Y le pedimos a todos los latinos que se unan a nosotros, que escuchen a nuestra gobernadora y se saquen la vacuna, la segunda, y se lo han hecho ya, que lo hagan la tercera vez. Gracias.
Gracias. I'll be happy to take any questions. The tough questions go to Ruben Diaz Jr. I'll take all the rest.
Just to clarify, you're signing the executive order today, but to give you all these different options, but for example, the MasterCard, they're not being called out yet, but this executive order will give you the power to do that and give this great.
Yes, the executive order, it would be needed for us to make any adjustments to the current licensing requirements for us to bring someone who's retired. We've sent out the alarm. We have a pool of individuals who want to help, but I can't do anything with respect to their licensing until the executive order is signed. Again, I'm hopeful I don't have to do this. I don't have to do this if people will get vaccinated. There's plenty of hours left in the day. But I also know I need to be prepared. And that's why we've just announced our action over the weekend to show that we are not relenting, we're not backing off. This is important. And I'll tell you, the calls I've had to the leaders of hospitals today have thanked me for being firm in this. And I would have much rather it just been voluntary, but if I have to take steps to protect the people in terms of making sure I have replacements if necessary, I need to take those steps now, and that executive order will do just that. So I'll be signing that today.
Governor, there's been some concern that some of the folks who won't get vaccinated and won't show up might be food service, custodial, other jobs like that. and that nurses will have to pick up the slack and essentially work longer hours until whatever staffing initiative can be put into place. How concerned are you about that, given the burden that folks like nurses have already carried?
No, it's a concern, and I'll tell you, my heart breaks for the nurses and the other individuals who've done the right thing, who now know, because not everyone was being persuaded to do the right thing, that they have to work harder and they're going to have more sacrifice. It's fundamentally unfair, and we're going to have to bring in people to help at all levels, no doubt about it. Again, it doesn't have to be this way. It does not. And it's not a role I relish. My default position is to ask people, please do this. This is why. It's been proven to be safe. The vaccine's been out there a long time now. There are not legitimate religious exemptions because the leaders of all the organized religions have said there's no legitimate reason, and we're going to win that in court in a matter of days. And so this is so unnecessary. And I just want to appeal to the individuals to know that, your coworkers want you to do this. Don't make the burden heavier on them as well. But I'm going to focus not on the ones who won't, but the ones who will. And again, all of us owe them a debt of gratitude for just doing the right thing and being willing to still suit up every day, go into the line of fire. They've been doing this so long, and my God, where would we be without them? Yes, sir.
Governor, what do you anticipate tomorrow looking like? I mean, what assurances can you give to people that healthcare facilities will run at least fairly smoothly, especially since it will take some time, as you're saying, down the road to put replacement medical personnel in place? And vaguely related, is your necklace, if you talk about this, does it say vax?
Sure does. It's a vax. I want to see everybody wearing these. My assurance is that we're taking all the steps preemptively in anticipation of what I call a preventable staffing shortage. Still preventable. Enough hours in a day. Come on down. Go to this place. There's plenty of places that can make this be a preventable, something that we just went through an exercise for but didn't need to. But I also am realistic to know that there are people who will not come back to their jobs. That is why we gave the warning out. People have known for quite some time that this was the requirement. And I've made it loud and clear over my 4 weeks in office that I was not going to change my position because I'm charged with protecting the health of all New Yorkers. So that's been a given. And so what's going to happen tomorrow is that these hospitals and nursing homes who've had warning that this is going to happen will be working with us later today and tonight to figure out where people are needed and how we can deploy them in essential areas. But in the meantime, I know some of the hospitals, not unlike what they had to do last year, I mean, they've already had to create more capacity. Some have postponed elective surgeries. They're doing what they can as well to make sure that the people who are in their care are continuing to receive good care. It is not going to be a perfect situation, but again, it's preventable.
Governor, I'm sure you've game planned this. How many people do you expect you're going to need to replace? How many people are going to resign or be fired? What percentage can you reasonably expect to entice to get shot? And thirdly, you're not the only governor nor the only employer trying to find these people. What makes you think you can find enough of them?
Well, that's a multifaceted question. I'll try to remember all the parts. How we think we're going to find enough of them. I also know that the state may have to supplement pay for people, bring people from out of state and elsewhere to entice them. I have no doubt in my mind that that's going to have to be the case as we bring people from elsewhere. Do I think that there's capacity for everybody who's not vaccinated to be vaccinated? Yes, I do. I just talked to the head of one healthcare organization. He has 48,000 people, 200 to 300 he anticipates will not show up for their jobs. He didn't view that as a challenge. I mean, they've already prepared for this. They're going to be able to handle this because 98% of their workers are vaccinated. Another one was 99%. Those are the downstate facilities. We have a different dynamic in some parts of upstate. There are other reasons why people are not being vaccinated. It's not the excess. It's a different philosophy is all I'll say. And those are the areas we've been focusing our attention on because those are the ones I don't know that people are going to change their mind in the final hours. So we've been in contact with the hospitals, in contact with the nursing homes, having them tell us what their expectations are. I won't have a clear number because there's a lag time. There will be people vaccinated today, I have no doubt. I've already heard that from practitioners and hospitals who've told me there's been an increase in the number of people getting vaccinated. So I don't have those numbers right now to know the exact percentage of people out of a workforce that we're going to need to be replacing. So it's an evolving situation. I'm not going to be able to give you the answers I'd like to give you until we know exactly what happens tonight, what happens tomorrow. Some people, some hospitals are saying that they're making some accommodations if someone's claiming a religious exemption, but they're also going to not let them do that. They're not going to let them work until some people want to see what's going to happen with the court case as well. I feel very confident about our chances in court. Just going back to 1905, a Supreme Court case that said that we have, communities have a right to self-defense. We have a right to defend our people against a global pandemic, and we're entitled to take all means necessary to do that. And that's what I'm going to do. This is all about self-defense. I'm here to defend the people of New York. Thank you very much, everyone.